Welcome to KRQE's New Mexico News Insiders. Here's Gabrielle Burkhart and Chris McKee. Sponsored by New Mexico PBS.
So more than 3 years now into this podcast, we've had a lot of interesting conversations. And Chris, I think one of my favorite things about our show as it's evolved is that we really get to shed light and pull back the curtain on some agencies in our community that people may not really fully understand or know about. And people can learn some really useful, interesting information, including us. I've learned a lot from our podcast. And today's topic, I feel like, is a really good example of that.
Yeah, we obviously get to learn a lot from our guests, and we hope that kind of rubs off with our listeners, our viewers here as well, particularly about the groups and the agencies that get to serve our community. You know, it's easy to forget sometimes when you don't hear from folks that maybe about just the important work that they do. So getting to shed more light on that is really important. So I want to bring in our guest here this week, all the way from El Paso, Texas. That is Carlos Briano. He's the Public Information Officer or spokesperson here for the DEA, Drug Enforcement Agency.
It's actually administration.
Really?
Drug Enforcement Administration.
Yep. Yeah, well.
Don't feel bad. That happens a lot. A lot of people think it stands for agency, but it's administration.
Yes, yes. It is clearly written here, I will say. Gabby pointed that out by patting the paper. I read agency. So right. Administration, the DEA, El Paso division as well, right, which serves serves New Mexico, I should say, as well as El Paso. Alpine, Midland, Texas.
Correct.
So, Carlos, thanks for being here.
Thanks for having us. 50 counties, that's a big area of responsibility.
Yeah.
But there's 23 divisions in the DEA, and they've divided the entire country into 23 divisions, and we have 17 counties of West Texas and the whole state of New Mexico. We're happy to be here.
Yeah. So I want to get into the specifics of our conversation at some point here, but first, let's just do the uninitiated high-level question. What exactly is the role of the DEA?
Well, the name it's the clue right there, right? Our primary job is to enforce the drug laws of this country, whether they're illegal street drugs or the medications that are controlled through the Controlled Substance Act. There's 5 different, there's level 1, level 2, 3, 4, and 5, all the way down. And so we got to make sure the doctors, pharmacists, any prescriber, even veterinarians, they're following the Controlled Substance Act and they're keeping track of those medications and not misprescribing them or selling them for profit. So that's the regulatory side of the DEA. And what a lot of people don't know is our outreach efforts. We do a lot of that as well. We were talking earlier off air about an award-winning curriculum that the DEA developed in conjunction with Discovery Education. That is a curriculum that teachers can use to talk to their kids about why they shouldn't use today's substances. You know, it's not like drugs when you and I were kids. Today's drugs are more powerful. They're synthetic, made with chemicals. So how does a teacher talk to their students about that? Well, we provided them the tools. We have family summits. We have Citizens Academy. Somebody in this podcast went through our Citizens Academy.
It was me.
It was.
It's okay.
Yeah.
You can
It was one of the two of us, and I don't remember it. So yeah.
We have workplace trainings for employers that want to help their employees who are struggling with substance use disorder. So there's just so much that we do as an agency on the prevention side. Because we fight the supply, but we also have to look internally into the demand.
Yeah. And we've had you on the podcast a while back.
Right.
We did an entire episode just focused on fentanyl. Yep. And I urge listeners to go back in their feed and listen to that if you want to learn really what is fentanyl, how much it impacts our community. Yeah. But fast forwarding to today, there's a new trend that we're seeing in New Mexico and nationwide that I want to ask you about, and that is a drop in fentanyl overdose deaths. So let's just start there. Why is that, and what is the DEA noticing about this issue?
Multiple factors. You know, the DEA, we're not going to take credit for that. We're part of it. You know, we are fighting the 2 cartels that are primarily making the fentanyl that comes into our country and into New Mexico. That's Sinaloa and Jalisco. And so we're really doing a lot of damage to those organizations at an international level because these two cartels are international in their scope. So we're really hitting them hard, where the amount of seizures are coming down, the amount of precursor chemicals needed to make illicit fentanyl is harder to come by for them. But I want to give credit also to all our prevention partners. They really have helped us raise awareness of how dangerous fentanyl is. In that podcast you mentioned earlier, we talked about how it's 50 times more powerful than heroin and 100 times more powerful than morphine. So a lot of kids don't see the danger. A kid who would never inject themselves with heroin doesn't see a harm in taking a pill, swallowing it, or smoking it, or crushing it and snorting it. But that drug is more powerful than heroin. So the partners that we work with, like Albuquerque Police, Albuquerque Fire, Bernalillo Fire, the Keep New Mexico Alive folks, Albuquerque Public Schools, they really have raised awareness in this greater area about the dangers of fentanyl, of street fentanyl. And I think people are more informed about what it can do to someone. If it doesn't kill them, maybe it leaves them with a terrible substance use disorder. If you talk to some of the treatment centers here in Albuquerque, like Serenity Mesa, the directors have told us that it's really hard to treat the teenagers that are addicted to fentanyl. They really struggle. So their desire is that they don't even try it once. And that's unfortunately what the cartels want. They want customers to try it just once, and then they keep buying more and more and more. And that's what they want. They want to drive profits.
That's what I was going to ask you about too, because we know the majority of fentanyl in New Mexico comes from Mexico, from the cartels, as you've outlined before. And the DEA does test for potency with the drugs that you do find. Are you finding that the potency has shifted? Like, are the cartels manufacturing it in such a way that they are not wanting to kill off as many of their customers anymore?
So thank you for bringing up the potency. A lot of people don't know that we have laboratories throughout the country. Where in those laboratories, forensic chemists, pharmacists, pharmacologists, scientists study and analyze the drugs that we seize, not just in the DEA, any federal agency that seizes drugs can send them to our laboratory and does send them to our laboratory for analysis. Just a year ago, guys, of all the pills that we will seize, because the primary method that the fentanyl is found is in pill form. There are some powdered forms out there, but the majority is in pill form. And so of the pills that we would test in our laboratories that we would seize in the DEA, just last year it was 7 of every 10 had 2 milligrams or more of fentanyl, which is the potentially lethal dose. Towards the end of the year, our administrator announced that our labs is finding that it's now down to 5 of every 10. So that's good news as well. So maybe that's part of the reason why deaths are coming down, that less of the pills out there contain a lethal dose, but that's still high. That's 1 of every 2. That's 50%. That's a coin toss whether your pill has a potentially lethal dose. But we're not celebrating yet. When I started with DEA 4 years ago, it was 2 of every 10. And then it went up to 4 of every 10. And then 6 of every 10. At its peak, it was 7 of every 10. So it's coming in the right direction. Just like the deaths in New Mexico are, the number of call-outs by first responders to potential overdoses, that's coming down. So it's coming down in the right direction, but there's more work to be done on the supply side and on the demand side.
We understand, and I think you've hit on some of these notes here, is that what has made fentanyl sort of a full-blown crisis really is 3 things. It's cheap, highly addictive, easy to conceal, compared to a lot of the other drugs that have come before it and maybe still come across the border as well. Overall, it sounds like yes. Is fentanyl still one of the biggest drug problems your agents are dealing with? It
is the deadliest. We talked off air about how methamphetamine is still the highest quantity that we seize. But fentanyl is definitely the deadliest. If you look at the CDC statistics for these deaths related to drugs, 70% more or less are fentanyl, and the remaining 30% are methamphetamine. And so those 2 drugs, that's the majority of the deaths. And that is the same across every state in in the country and also in New Mexico. So the thing that those two drugs have in common is they're not organic drugs. There was no plant that had to be grown to make it. It was synthesized in a laboratory with chemicals. You know, and young people need to know that. There's a lot of very health conscious young people out there, you know, that work out religiously, you know, want to eat whole foods, clean food with no GMOs and no pesticides and, you know, no chemical additives, you know, maybe cage-free, whatever, you know, but they're consuming substances that have a lot of chemicals. And so that's one of the things we seek to, through our education, through the curriculum that we mentioned earlier. We want young people who are smart. You know, they don't need to be talked down to. We don't need to fearmonger them. They need to know what is going into their body. They're still developing body. You know, the human brain takes 25 years to fully develop. What these substances do to their still developing body so they can make informed decisions. Mm-hmm. And that's what we want for them.
You mentioned meth and fentanyl. What are some of the other main drugs of concern that the DEA encounters in our communities? What are DEA agents running into the most aside from fentanyl?
When fentanyl first started coming up, heroin was still one of the drugs we seized. But as fentanyl increased, heroin was coming down. And there was a couple years ago where the fentanyl seizures were higher than heroin. And so we still periodically seize heroin. Cocaine is still out there. And we still, when we do investigations with drug trafficking organizations here in New Mexico, we still find with their meth, their fentanyl, with their cocaine, weapons, illicit marijuana, money, cash, virtual. So these drug trafficking organizations don't focus solely on the methamphetamine and fentanyl. They traffic in whatever they can do to make money. And that's why our partnerships with other federal agencies, state agencies, and local agencies is super important. Because when a drug trafficking organization starts trafficking humans as well, we need to work with HSI, with FBI. And so that's why a lot of our investigations are joint. And you've seen that, right? When you see the press releases from the U.S. Attorney, you'll see all the agencies that supported, whether DEA was the lead or another agency. It always gives credit to the other agencies that assisted, which are often Albuquerque PD and Bernalillo Sheriff's Office.
Yeah. You know, we mentioned in the beginning just how wide of an area your district covers, the El Paso district, parts of New Mexico, and then parts of West Texas. I think you said it was more than the 30.
The whole state of New Mexico is what our division covers, and 17 counties of West Texas. So that's 50 counties total. So it is a wide area, but we have five offices that cover that. We have agents in El Paso. We have agents in Midland, Texas. We have agents in Alpine, Texas. We have agents in Las Cruces for southern New Mexico, and we have agents in Albuquerque for northern New Mexico. Now, of course, we all support each other. You know, sometimes if there's a big warrant execution in one of those areas, the other divisions will assist. Sometimes other divisions will assist, you know, depending on how close it is to our, you know, where our divisions touch. You know, we ask for each other's help because these drug trafficking organizations don't like, oh, well, this is where our territory ends. They will go wherever the profits take them. So we have to collaborate with other divisions all the time.
Well, it's interesting, too, because the region, you know, when you think about New Mexico and Texas, right, politically, they're very different. You know, New Mexico is a very blue state when you look at just the elected officials, and Texas has far more conservative elected officials. So with that in mind, what are some of the major differences in maybe the problems you see between these two areas? Because as we mentioned, the politics are different, so you're going to see different policies as they relate to drug policies as well. And like, for example, Texas does not have recreational cannabis, whereas New Mexico does. So, yeah, what are some of the major differences in the problems those two areas are facing, New Mexico and Texas, when it comes to?
I don't think those drug trafficking organizations are blue or red. I think if I had to give them a color, it's green. To them, it's all about profit. They just want to, and so because they're so focused on profits, their lawlessness affects both blue and red communities. And we've found that the DEA, that the law enforcement and the officials in those areas want to reduce drug trafficking in their community. They want to reduce deaths related to those drugs in their community. They want prevention education in their schools. And so when we at the DEA, the men and women of the DEA, approach them, can you collaborate with us on an enforcement activity or on a community outreach event? Their answer is always yes, whether they lean left or right. So we're very thankful for those communities that support the DEA in whether it's West Texas or in New Mexico. We find support from those areas as well. What I will say is we need support from the members of the community as well. If they see something, we want them to say something. They can do so anonymously if they want. If you go to DEA.gov, right on the top corner, there's a submit a tip button, and they can submit a tip anonymously. Sometimes they think, man, my tip went unanswered. But we just had a big operation in Las Cruces, I'm sure you heard about it, where when we started arresting all the drug dealers that were their neighbors, that the people had submitted tips for, our agents received applause as the warrant executions were done and we arrested. The neighborhood didn't want them, these drug dealers in their community, and they reached out and we did something about it. It wasn't as fast as they would like because they don't understand that a federal investigation takes longer. We need to build evidence. But when we finally executed those arrest warrants and search warrants, the neighbors came out and they literally applauded. So we're very thankful when the community speaks up and says something. And I do want to remind them, we're not aliens. We live in the community that we serve. You know, we work there. Our kids go to school there. Our spouses have a job in the community. Some of us shop in the community where we live, worship in the community. So we're a member of this community as well. We're as vested in making our community healthy and safe as you are. So reach out to us. We want to make our communities where we live and work and play and worship as safe as you.
Do you see, though, a difference in the drug problems that you guys encounter in those two different states? Are there different issues?
The deaths, unfortunately, are as bad in any city and any state in our country, unfortunately. I challenge you to go to the CDC website. There's a map that shows you, how many deaths per state. And unfortunately, there's not a community that is exempt from this, unfortunately. I don't know of any community in our country where they're like, no, we don't have any drugs in our community. So in that sense, yeah, we do get the support from every community across our area of responsibility because they want the same things that we do. We want to make our community safer and healthier.
We'll be right back with more of the New Mexico News Insiders.
Hi, I'm Logan Rader, host of New Mexico Living. New Mexico News Insiders is sponsored by New Mexico PBS.
If you like New Mexico News Insiders, learn more about New Mexico in Focus, a weekly hour-long show analyzing decisions impacting New Mexico statewide. Stream it anytime, anywhere. Visit nmpbs.org and follow them on all social media platforms.
Now back to New Mexico News Insiders.
I want to ask you, too, about the idea that we now have several states across the country who have legalized recreational marijuana. It's still illegal on the federal side. So are you all still doing marijuana seizures at the border as much as you used to? And has the legalization stateside caused any residual problems in your view?
So I want to clarify that we're not the ones that seize them at the borders. At the ports of entry, that's the CBP and HSI. They're the ones that are responsible for border seizures. At the checkpoints, also Border Patrol. We do cover a lot of port of entry when drugs are seized at a checkpoint. our partners at Border Patrol will call the DEA for us to respond and to do the investigation, because rarely is it just that. Like I said, there'll be some pills, there'll be weapons, there'll be cash. It's a illegal activity that they're performing. So our agents will respond to carry the investigation across. Right now, cannabis is being looked at the federal level. So it's in the process. We at the DEA are a part of that process, but because it's they're looking at the regulations, whether it's going to be classified from a control substance 1 to 3. That's all I can say, that it's in the regulatory process.
Right. But I mean, like, has there been any residual problems when it comes to drug investigations, like, say, in El Paso, Texas, where it's so close to New Mexico, where you have legal recreational cannabis? Are you having to deal with illegal?
Our focus in the DEA remains fentanyl and methamphetamine. And that's our priority, because that's what Sinaloa and Jalisco are primarily focusing on. And so as we seize the methamphetamine and the fentanyl, if they have other illegal substances or weapons or humans, then we'll deal with that with our partners.
Got it.
So we know DEA agents, they also work overseas tackling drug problems, targeting big fish that, as you mentioned, cartels and whatnot as well. Wanted to see if you could share any unique cases or examples where U.S. agents have tracked people in other countries and put together a criminal case. Anything that maybe stands out to you?
So I wouldn't be the person to ask that question, because I don't know. My sole focus is New Mexico and West Texas.
Yeah,
but you are right.
Overseas.
Yeah, but there are cases. And the public can go read about them. If they go to DEA.gov and click on the who we are, it'll show the domestic side and the foreign, what our foreign work. And all the releases about all those cases are there. And you can go and read for yourself. People forget that whenever we do a case and it becomes adjudicated, which means it's come to a completion, they were either found guilty or not guilty. Once that happens, we put out all the information and someone can read it. We publish an annual report. It just came out, called the Threat Assessment. And they can read everything we've discovered in 2024, not just domestically, but foreign. And so those cases, if the public is curious about it, they could go and read for themselves. In fact, I get a lot of inquiries from collegiate students that are doing research papers about drug trafficking organizations and trends that we're seeing in the DEA, and they want to do an interview for their research paper, or maybe for a scholastic podcast or scholastic newspaper or whatever. I always point them to that document. I go, read this 100-page document that has everything that we have found in 1 year. Read it. If you still have questions that were not answered on that document, give me a call and we'll see if we can fill the gaps. 99% of the time, all their questions are answered in that document. So if the public or you guys want to read everything that we know, that we discovered last year in the DEA, nationally, domestically, internationally, you can read that. It's called the National Threat Assessment. Just Google National Threat Assessment. It's probably on DEA.gov right on the homepage, and have at it. Start reading that 100-page document. It's excellent.
That was one of the interesting things that I took away from the Citizens Academy, though, because you had agents who came in and actually did talk about their investigations overseas.
Yes.
But I guess from you, without having to go to the website and read, can you just share with us, like, DEA agents have some pretty good relationships with those like foreign partners in law enforcement, right?
Well, let's go back to what we were talking off the air about what do you attribute the deaths to? One of the things that I like to attribute those is to the good work that the DEA does at a foreign level in partnership with the U.S. government, the State Department, working with the countries that primarily produce the precursor chemicals needed to make fentanyl and methamphetamine. Our agents and the federal government working with those countries, the leaders of those countries, to, hey, you got to be more careful with these precursor chemicals because Mexican cartels are turning it into fentanyl. We know there's a legitimate use for these precursor chemicals, but you got to be more careful, You just can't be fulfilling orders from anyone. You got to, lock it down a little better. And that's some of the work that our foreign agents do. They serve as liaisons. They're constantly working. When the governments of those countries want us to help them fight drug trafficking in their countries, we're there. We're only there if the country of the government of that country has asked us to, hey, help us out with this. And so that's, I think, the biggest takeaway that I see at my little local level of the work that our agents are doing internationally.
Okay. Let's talk about some of those other initiatives of the DEA. As I mentioned, I did the DEA Citizens Academy last year, where I went through those night classes with a lot of other community members.
Which is very rare, okay? I mean, that was only our third Citizens Academy since we started as a division in 1988.
That's cool.
So, and this is very new, and it's part of Operation Engage. The DEA identified 11 cities throughout the country that we said we want to really engage with those communities on a harder level, more than normal, things that we've never done in the past. And Albuquerque is one of those cities. So because of that, one of the strategies that we utilized was the Citizens Academy. And so that was just class number 3 that you were a part of.
All right. Well,
part of an exclusive group.
Yeah.
I guess so.
And they've only had like 20 people each one. So there's only like 60 people that have done a Citizens Academy in Albuquerque. So
I want to talk about it a little bit because the community members that were with me, I was the one of 20. Right. They just ran the gamut. Like there was a teacher, there was some chemist, a chemist. There was some APD people. There was a chaplain. Lots of different professions. Right. But I did get the sense that all of these people really just wanted that knowledge and wanted to make a difference in their community with that knowledge. Yes. So, but from your perspective, because I was the student, you were part of the people running it. What is the mission overall behind those Citizens Academies?
We want them to know that the DEA, what we do, first of all, maybe some of them formulated their impression of DEA from Netflix.
Yeah, the movies.
Breaking Bad, we're in Albuquerque, right? Maybe they formulated their opinion of DEA from Breaking Bad, which FYI, PS, the DEA helped as consultants on Breaking Bad. One of our forensic chemists consulted when it's like, we want to make this RV into a mobile laboratory. What we had one of our DEA chemists guide the producers of the show on, well, this is what you would need, and this is how you can make it look realistic, and and so we help with that. In the pilot, some of our agents were a part of that Netflix, the very first show for Breaking Bad. So we supported that program when it first came out. But we want them to formulate and know what the DA does from ourselves. Many of them came in with preconceived ideas. Even that you did a lot of stories about DEA in your past. You had some better knowledge of what we do, but even you learned some of the things that, I was not aware of that. And so we want the public to know what DEA does and why we do it, and for them to know, hey, we live here too. We're part of your community. The mission you have to make your neighborhood safer, we want that the same way, and this is how we do it. And then more importantly, we told them this is how you can help. Help the DEA with that mission. And some of them felt empowered to now, okay, this is what I can do. Whenever I know of this situation, this is what I do. When I need this is what I do. And that's what we're trying to do. And that's the mission of Operation Engage, really engage with the community so they know what to look for, how to help the DEA with what we do.
We'll be right back with more on New Mexico News Insiders.
Hi, I'm Monica Wicki, host of New Mexico Living. This episode of New Mexico News Insiders is sponsored by New Mexico PBS. If you enjoy New Mexico News Insiders, check out New Mexico in Focus, a great source for insights about what's happening in our state. Catch their podcast and videos at nmpbs.org or stream it anytime, anywhere on the free PBS app. Now, let's continue to New Mexico News Insiders.
You mentioned as well, speaking of engaging with the community, one of the other things that the DEA has is this sort of curriculum for schools, learning about opioids and prescription pills. It's my understanding that APS, Albuquerque Public
Yes.
Schools, is the only district right now in New Mexico
Yes.
that is using this curriculum in schools.
Yes.
And I think we talked a little bit about this in the past. When we grew up, I was born in the 80s, and it was DARE when the time I came in. Keen viewers may see this sticker. It says actually a riff on DARE. It's about the basketball player named Damian Lillard. But that was the logo that was everywhere, DARE.
Yeah.
This made by a graphic artist named Evan M. But this isn't like DARE,
No.
this new curriculum here on the schools.
No.
This is something different. What are kids learning in this?
So about 8 years ago, we approached Discovery Education, which is a world leader in curriculums. They're more known to the general public for the Discovery Channel. But among educators, when you mention Discovery Education, their ears perk up, right? Like, oh? So we partnered with them and said, you guys are experts in curriculums. Can you help us at the DEA design a curriculum that's science-dense, evidence-informed, that teachers will be like, oh, I can use this, that meets national standards of learning? Can you help us with that? And of course, they said yes. So we developed that curriculum that's ready to use for a teacher. I don't know if you guys know this about me, but I was a high school teacher for about 10 years. I was a finalist for Texas Teacher of the Year. So I vouch for it. So when I was a teacher, my subject was journalism. I was teaching kids how to take photos, how to write compelling titles and leads, how to do interviews. I didn't know I was going to have to talk to them about dating or nutrition, or when I would catch them smoking or drinking, about substances, about suicide thoughts. And so when a teacher encounters these issues, and now I'm sure they're encountering substance use in their class among their kids, probably like I did, honor roll kids, top in their class, dabbling with that. What do I know about substances? How do I talk to my kids that see me as a mentor about this subject? That's what the curriculum does. And so it empowers the teacher through these lessons how to broach different topics. And it's not just fentanyl and opioids. There's lessons on stimulants, on hallucinogens, depressants. It categorizes the substances. It talks about the science of addiction, what it does to the body, how to make proper informed decisions about those things, how to seek help if they need treatment. And so it has ready-to-use lessons that the teacher can download with activities already built in. Little videos. There's a portion in the lesson where you press play and show them either a cartoon video or a student-produced video or a virtual field trip where maybe the school can't go visit our lab, but they can see a video with one of our chemists. Maybe they can't go interview a special agent in charge, but they'll see a video. Maybe they can't see our warehouse where all the drugs are in person, but they can see a video. So that's what the curriculum does. And it gives, in a very easy to use for a teacher, way to broach that subject. And more importantly, it has a parent toolkit. Then if the teacher decides to, I'm going to send some homework about this subject, send it home, there's something for the parent. The parent can see in English or Spanish, this is what is being taught to my kid. Now, how do I continue that conversation at home? So that's why it's won so many awards. And I commend Albuquerque Public School leadership for being the first in New Mexico to say, yes, we're going to start using this. I hope other educators are listening to this podcast and say, how do I get that? Because you don't have to wait for your school district to implement it. You don't have to wait for your principal to start it at your campus. If you, as a teacher, want to use it in your classroom, you can. It's operationprevention.com. Just go and check it out.
One thing that stood out to me, I was poking around on the curriculum yesterday on the website, and then also just like learning about this in the academy about opioids, is just like the simple message of only taking pills that are prescribed to you by your own doctor.
Yes.
And it sounds so simple,
Yes.
but there may be situations even as an adult where, you have adults sharing their pain pills maybe,
Yes.
or, here's this back medication if you have a headache, whatever.
That's a terrible
But there's so
habit.
much
Yep.
risk involved in
Yes.
that, right? And for the elementary kids curriculum I saw, it was just very simple, like how to read a pill bottle.
Yeah,
Who
labeling.
takes this? Yeah, simple like labeling instructions. How do you talk to kids about that, though? Because that message of just like only put something in your mouth that a doctor gave you.
Well, I talk to third graders all the time, and we feel in the curriculum in partnership with Discovery Education, we felt that third grade was the first time that we can start talking to kids, and they have a understanding of what substances are. Illegal substances. So the way you said it right now is how I do it. When I'm talking to a bunch of third graders, I say, guys, never, ever take anything that was given to you by a friend. I even tell them, who is the only person at the school that can give you a medication? Because it's not a teacher. Teachers aren't allowed to give medications to their students. Not the principal, not the security officer, not the counselor. And they always answer, the nurse, the school nurse. Exactly. Never take a medication that was not prescribed to you or given to you in your hand by the person who cares for you. Because, sometimes they don't live with their parents. Sometimes it's a grandparent. Sometimes it's an aunt, an uncle. So whoever you live with, if they give you the medication and it's yours, that's the only person you should take it from. Not your friend, not your teacher, not the principal, only your medical professional and the person that cares for you. And that, if we all did that, including us adults, that would do a tremendous service to our community, because you're right, we do have a terrible habit of sharing medications. And that's one of the things that we in the DEA, when we do our takebacks in October and in April, we remind them, okay, well, thank you for bringing us your unused, unwanted medications for proper disposal, but let's also not share those medications, because a lot of people won't dispose of them because like, no, I'm going to save this in case I need it later, or in case I have a friend or relative that needs it. But now you're practicing medicine. You don't know if that friend or relative has a condition that would prohibit them from taking that same medication that you can take, or what comorbidities they have. So I tell adults, when I talk to adults, we got to break that habit of sharing medications or storing medications for future use. If I develop what I think is the same symptom, I got to see a doctor, because it may be something different that the doctor needs to prescribe a different medication.
Outreach on the topic of, family summits, as we understand, are another component here, community-based initiative the DEA has been hosting.
Another new thing.
Yeah, what are they?
So at the height of where we're seeing these deaths, we're hearing from so many members of our community that they wanted to do more. They wanted to turn that pain into positivity, or become activists or proponents, or they wanted to know, what's the status of the investigation of my loved one. My loved one was murdered by this drug dealer. And so as we saw more and more of those encounters, our administrator, Ann Milgram, said, I want you guys, she started by doing one nationally, invited a bunch of organizations like the Keep New Mexico Alive one. They actually attended the national one a few weeks ago. I think it was in November. The folks from Keep New Mexico Alive went to DEA headquarters, and participated in the national one, the third one. But it was a listening session. You've suffered the tremendous loss of a loved one. Thank you for not going into hiding, because there's a stigma when we lose a loved one to a substance use. We don't want to talk about it. We're maybe embarrassed, ashamed. But if our loved one had died from a car accident or due to cancer, we don't hide. We don't go into darkness. So we thank them for being vocal about the loss of their loved one in the effort to try to prevent another tragedy. So they're doing what they wanted to raise awareness or to advocate for change, policy change, legal change. So we invited them and asked them, what can we do to help you in your efforts? What can we do differently to help you with these situations? And so that was the beginning of the family summits. It was a national. It was so successful at the national level that our administrator said, you're going to do a regional one now in your area of responsibility. So our first one was in El Paso. Actually, Albuquerque and El Paso, because the Keep New Mexico Alive folks were planning one for September, and then we did ours in October. So we did one in Albuquerque and one in El Paso, and now we've done 3. Last year, we moved it to Shiprock, because we were seeing in the Navajo Nation a lot of deaths, also a lot of substance use. And they asked, can you guys do a family summit in our area? And we said, of course. They opened the doors to us, so we went. And so we've done 3. We're going to go back in 2025 to Shiprock and do it there. So that's the point of these family summits. We hear from them. We share with them what we're doing. As a result of these family summits, there's now a lot of overdose investigation teams throughout the DEA, where members, special agents, in partnership with local law enforcement, with local medical examiners, open up investigations to investigate. And when applicable, bring charges. There's federal charges that are called distribution causing death. And so that's a heavier penalty. If you kill somebody, the minimum is 20 years. Even if they overdose but live, like the hospital saves them, that's called distribution causing bodily harm. That's also 20 years. The state of Texas, you asked about what are the differences, passed a recent law where they can be charged with murder. So depending on the circumstances of the case, these overdose investigation teams will do an investigation and try to bring charges, maybe not to the street level dealer, but they figure out who the source of supply is and try to build a case showing that they knew that it was fentanyl and they could potentially kill somebody, but they didn't care. And they sold it anyway. So a lot of charges. We recently sent out a press release about, it's called OD Justice. And we sent out a press release about various cases where different divisions did investigations and brought charges against the dealer that killed somebody. And there was one case from El Paso. Yep.
You have a lot of irons in the fire, it
We
seems,
do.
with the DEA. And I know you're making the rounds.
And I'm trying to keep them in my brain all organized. I hope I'm doing okay.
Yeah, you're doing good. But is there anything else top of mind that we didn't ask you about that you want people to better understand or know about the DEA?
Yes. I bet you no one in Albuquerque knows that we made a website specifically for them. It's called abq.dea.gov. That's pretty easy to remember, right? abq.dea.gov. We invite the public listening to this podcast to go check it out. If you like what you see there, subscribe, you put your email, and whenever there's going to be a youth event, a Citizens Academy, an employer training, anything, through Operation Engage, and you want to be a part of, you'll be sent an email. So you can apply or subscribe or sign up. All our events are free. We don't charge the public for anything. And so if you want to be a part of a Citizens Academy or you want to build lowrider bikes with kids, or you want to play basketball with some agents and some kids, or you are a business owner and want to learn how to implement assistance for your employees who are suffering with substance use disorder, et cetera, et cetera, et cetera, you'll get an email notification when it's time. And so abq.dea.gov. And there's only 11 unique sites like that. And Albuquerque is one of them. So
okay,
kudos for Albuquerque.
Awesome.
Yeah.
Well, Carlos Briano, thank you so much for your time. We appreciate it.
No, thank you for having me again. It was nice to come back. Unfortunately, now on camera, right? So I have a face for radio.
It's all right.
But now people see, who's the person talking to them. I also encourage them to go and listen to that fentanyl podcast. I'm sure you have it archived there.
Yep.
Yeah, that was a good one.
Absolutely.
Thank you.
Again.
Thanks for having us.
Yeah.
Look forward to the next one.
Thanks again to Carlos Briano with the DEA El Paso Division, which again covers the entire state of New Mexico as well. He is a wealth of information.
Yeah.
A lot to learn.
Absolutely. They've got a lot of outreach efforts, and also it is the Drug Enforcement Administration. Just to be clear here, made that mistake, we'll make it again. So.
Oh, I think our listeners will know now as well.
Gonna roast me for it. Brief cup chat. Thank you, Gabrielle, for this New Mexico News Insiders coffee mug.
We have merch now.
We have merch that is unavailable to anyone.
Although I bought that merch by myself.
That's true, and also that sticker says "to keep coming up clutch." Just so anyone, if you were watching. It's about Damian Lillard, as I mentioned in this.
You get a lot of questions about that sticker, I'm assuming.
It looks just like the Dare logo of our childhood, but it is a riff on that again from a graphics artist named Evan M. So Portland Trail Blazers colors here as well. I digress.
We digress.
Yeah.
If you all have a story idea or someone you'd like to hear from on our show, feel free to reach out. I'm Gabrielle.Burkhart@krqe.com via email and gburknm on social media.
I'm at Chris McKee TV, also chris.mckee@krqe.com. Thanks for listening. Also, leave us a comment on Spotify. We read those, react to those, and if you want to watch the full version of this conversation, go to youtube.com/krqe or krqe.com/podcasts. Thanks for listening and watching.